my dear friend and colleague, Dr. Garrett Chan, who's CEO of Health Impact California. But he is also a frontline expert nurse practitioner and clinician in the emergency department. So he knows rapid clinical reasoning in crisis situations. So help me out here. How does this jibe with your experience as an emergency department?
The understanding of what it means to be ill, especially with patients who are undifferentiated, so we don't know exactly what's going on, is one of the essential characteristics of any patient who comes to the emergency department. And so as we're starting to
It's like, how do you tell how sick they are? Just by looking at them?
how sick they are and what is actually the underlying pathology that exists. And so I was working as a nurse practitioner in an emergency department, and I had a patient in the emergency department who was 70 years old, and it was a gentleman who had been working in the garden the day before, and the triage note said that he had sustained a laceration on his leg. His vital signs were within normal limits generally, except he was febrile. And so when I went to go see him, I immediately noticed that he wasn't looking well. And when I went to go talk with him, he was a little obtunded. And so I had to ask his wife to supplement the history that I was eliciting. So within 2 minutes, I realized that this patient was much sicker than was initially presented on paper. And so I moved him immediately to our major resuscitation room and looked at his leg and noticed that the erythema was quite expansive, very hot to the touch. And I thought, this happened very quickly, too quickly for us to think that this is a simple cellulitis. As a matter of fact, I think this is necrotizing fasciitis.
Wow. Oof.
Yes. And so I started mobilizing the team. I contacted an attending physician and said, we need to intubate this patient quickly. We need to get surgery here to evaluate the leg for any chance of survival for this patient. As people were getting prepared and I was giving the orders for the antibiotics to be given, I realized that the wife was sitting near the bedside in the resuscitation room. And I went over to tell her that she needed to speak with her husband because this may be the last time she was able to speak with him for a very long time, possibly ever. And she looked at me, and it was hard for her to comprehend, but I did tell her that he was very ill, critically ill, and that we may need to amputate his leg if surgery decided that that was the right course of action. And so I brought the chair closer to the bed and had her speak with him. I said, you need to tell him what you feel about your relationship with him, how many years that you've been together, and to tell him that we're going to take care of him. And she did. She had about 4 minutes to have that interaction with him. And for me, it was a very important piece of nursing practice that we look at the patient as a whole and understand that they are more than just a pathology, that we actually have a human in the bed.